All right. So, good afternoon, distinguished member of the press. On behalf of the Liberia Association of Nurses and Anesthetists, we want to welcome you to this very important press conference this afternoon. The Liberia Association of Nurses and Anesthetists is a legal professional healthcare association charged with the responsibility of advocating for our members within the length and breadth of Liberia. We are also responsible to collaborate with the Liberia Board for Nursing and Midwifery for the best interests of our members. Today we are here to honor this press conference under the leadership of the Liberia Association of Nurses and Anesthetists, distinguished member of the press, as we get to our General Secretary to take us through the press conference by reading the press statement. We would love to quickly introduce ourselves. The introduction will go in this manner. We call our name, the position we bear within the institution or the association, followed by the entity that we are working for on Ministry of Health. By way of introduction, I am Mepen Dolo, the president of the Liberia Association of Nurses and Anesthetists, and Nurses and Anesthetists assigned at Redemption Hospital on Ministry of Health.
My name is Ali Perry, the anesthetic assigned at Liberia Hospital in Tama.
I'm Joseph Estanapoli, nurse anesthetist assigned with CH20 Hospital in Martinique County.
My name is NSS Gwe, Secretary General of Liberia Association of Nurses and Anesthetists, and assigned at St. Health Center, Grand Cayman County.
So my name is Augustine Tuma Jr. and I'm assigned at the Redemption Day Hospital in Bhutan, Bushra Island.
My name is Omidayo T.K. Buna, nurse anesthetic assigned at John F. Kennedy Memorial Hospital, JFK.
My name is Joshua Poha, nurse anesthetist assigned at Redemption Hospital, MOH.
Distinguished member of the press, at this junction, we love to acknowledge and welcome our members who have come to grace this occasion. And on this note, we'll turn the floor over to our General Secretary, Mrs. N.S. Square, who will on behalf of the Liberia Association of Nurses and Anesthetists, followed by question and answer from the team of journalists.
Thank you so much. Subject: government's failure through the Ministry of Health, CSA, Ministry of Finance to reclassify anesthesia providers and mid-level health workers. The Liberia Association of Nurses and Anesthetists, LANA, is a legal healthcare association that is responsible for advocating for all anesthetists and anesthetists working in government-connected hospitals and private hospitals across the country. We are also charged with the responsibility of collaborating with the Liberia Board for Nursing and Midwifery for the licensure of our members. According to the World Federation of Anesthesiologists and International Federation of Nurse Anesthetists, IFNA, our country is still far below the minimum practice standard, with only 7 nurse anesthetists and 82 licensed nurse anesthetists in the country. And we believe that the urgent need for equitable pay has never been clearer. To meet the minimum International Federation of Nurse Anesthetic Practice standard, our country still needs about 320 additional anesthesia providers. Because of the limited number in country, most of us are working throughout without day off and even on vacations. About 98% of anesthesia services are provided by our members, but we are yet to get fair compensations that aligns with our qualifications and clinical responsibilities. While it's true that there are approximately 4 Liberian physicians who have acquired anesthesia educations and back in the country, the workload still remains huge on our members because some of those physicians are in administrations. Before we proceed to the issue under discussion, let's take a look at the journey to becoming a professional anesthetist and nurse anesthetist. The journey to becoming a professional anesthetist is rigorous and demanding, requiring a total of 12 to 15 years of high school education, followed by an additional 5 years of specialized studies and a year of internship before licensure. Similarly, nurse anesthetists do go through the same 12 to 15 years of high school education, followed by 4 to 5 years of nursing education to become a registered nurse, before proceeding to anesthesia education, which may require 3 to 4 years. It's disheartening to see that despite this extensive training education, this government has failed to establish a fair and standardized pay grade for these essential healthcare professionals and other male health workers. As we don't want to engage in discussions that will undermine the contribution of other medical professionals, it is essential to bring to the public attention that the government's decisions through the Ministry of Health, CSA, and the Ministry of Finance to reclassify about 91 specialized doctors halfway and bring payroll but leaving other specialized healthcare professionals untouched is a step meant to undermine the peace within the health sector. This is going to lead a divided, task-oriented, and fragmented health sectors rather than a team center. However, it is crucial to respect the unique specialties and services provided by each professional. As specialized nurses and health professionals, we are under compensation for our vital roles, but the government has refused to listen. Currently, our members are experiencing unjustifiable disparities in salaries. For instance, despite having the same qualifications, work hours, tenure, nurse anesthetists and anesthetists in the same institutions are being compensated differently, with salary ranging from $413.35 to $760. Some of our members who have obtained master's degree in teaching at the level of the only anesthesia school in the country are still undercompensated. This inequity is not only demoralizing but also undermines the vital roles we play in the healthcare system. Since April 2024, we have engaged with government officials to advocate for the reclassification of even proposing a temporary alignment of all anesthesia providers' salaries to $760 and compensating our members who have obtained master's degree to $900 until a fair, comprehensive pay structure can be established by CSA. Unfortunately, our concerns have not been addressed, and we have been met with silence and claims of insufficient funds. But the government has recognized medical doctor specialties. Remember that we aren't asking to be paid doctor's salary, nor either increment, but salary that is currently being offered to some of our colleagues. Sadly, some months back, the government, through the Ministry of Health, deceitfully deceived us by bringing in one Doris, who they claim to have been sent by WHO as a consultant to help create a policy document that could help solve our problems. After 4 to 6 months of wasted times, We were shocked to have heard that the government wasn't in the know of such work. After such a frustrating news, we wrote the government asking for a way forward, but no listening ears were given. When we noticed that the government has started fiscal year 2025 budget formulations, we left the hospitals for 3 days to help draw government attention to our issues. And the government, through its Deputy Director General of CSA, Mr. Darlington Smith, came along with the CMO, Dr. Catherine Cooper, and told us that the fiscal year 2025 executive budget draft was going to significantly address our issue. But sadly, we only heard of $50 United States dollars increment in our money gross. After such pronouncement, we wrote the government through the Ministry of Health, expressing our frustration and disappointment, and gave them 7 working days to have our issue resolved. Otherwise, we were going to strike. In our communication to the government, we brought to their attention that the addition of 50 United States dollars wasn't best approach in solving the issue of disparities. For instance, if an individual is earning $413.35 and another individual is earning $600 US, will the addition of $50 US across the board solve the issue of disparities? Absolutely no. The government's refusal to listen to our concerns left us with nothing but a go-slow action. Our recent go-slow action, initiated on December 12, aimed to highlight these issues and draw attention to critical role we play in the healthcare system. While we recognize the urgency of the situation, it is disheartening to note that our calls for justice have been overlooked. On the other hand, the government has prioritized resolving issues for physicians and leaving we and other May-level health untouched. Physicians, whose 80 to 95% of surgical work depends on our collaboration, primarily were attended to but left us untouched. They didn't strike as was planned during their press conference only because their issues were somehow attended to. The LNDA leadership told the national government that our role is significant to enhancing their surgeons' job. And the health sector is a very unique sector that calls for teamwork, but the government refused to listen. As we have made decisions to return to work in the next 48 hours, we want to emphasize that while we are committed to our duties, the lack of resolutions on this matter means that some cases may still be referred elsewhere due to the limited number of nurse anesthetists and anesthetists in some facilities. So resumption of duties will officially commence on Monday, January 6, 2025 at 7 a.m. While some stakeholders may remain insulated from the repercussions of our go-slow action, we have noticed that our actions are only affecting those financially challenged citizens. As we all know, undercompensation may lead to demotivations. Moving forward, we are going to review our members' schedules and make sure it is in line with the international best practicing standards, and we will take a copy to our legal team for onward consultation with the Labor Ministry. We are going to work on the Decent Work Act to help ensure the best labor practices. 48 hours weekly is what required for each employee, and we are going to make sure that our members abide by these international best practicing standards. which urge stakeholders to recognize the essential conditions of anesthesia providers and other male-level health workers, and to advocate for our rightful compensations, as our decisions to resume is not meant to show our weaknesses. We are returning to hospitals because we have noticed that many of our stakeholders have not been affected by our actions. Our actions have only created challenges for our citizens who are financially challenged. The majority of these stakeholders who have been thinking of resolving our issues are seeking care at private hospitals and even abroad. The total amount required to ensure equitable pay for our members is just $438,200 United States dollars annually, a small price to pay for the dedications and expertise that our members bring to the healthcare system. Despite our decision to resume services, we will be informing our partners and the International Federation of Nurse Anesthetists of this critical issue. In closing, we called upon the government to prioritize the compensation of anesthesia providers and our colleagues, male-level health workers, recognizing the essential roles we play in saving lives and supporting the health sector in Liberia. Our doors are open for dialogue with stakeholders who understand our importance and wish to intervene in this critical matter. Thanks for your attention. The Liberia Association of Nurse Anesthetists.
Distinguished members of the press, at this junction, on behalf of the leadership, we would love to appreciate our General Secretary for taking us through the press statement. And on this note, we will turn the floor over to the team of journalists for question and answer.
So I'm Francis Boy, and I read for the famous Front Page African newspaper. In your conclusion, you called upon the government to prioritize the compensation of you and that of your colleague. So, but you didn't mention any specific limitations of the government prioritizing your compensation. So why, if the government keep ignoring your quest to compensate for the outgoing salary, what would be your next course of action?
Okay, so the issue of time is something that we don't want to dwell on anymore, because it has been clearly proven that the government don't have sorry to say that. We been on go-slow action since the 12th, and I think it relates into the press statement. We started the whole process. We started like the reawakening the process since April, and it ended up with a go-slow action. And while we were on go-slow action or we were out of the hospital, the doctors came in and made a pronouncement of 10 days being given the government to reclassify the health sector, including their specialists. And later on, today we are here. You are not seeing doctors among us, and you are not hearing any concern from doctors over the past period of time. There are 10 days given the government. They last on the 26th of December. They did not come out again to tell the media whether that issue was attended to. So for us, we feel that we are being neglected by this government. Sorry to say, people will consider it a bit political, but it's not political. It's just the reality. So we have just considered, for the sake of the Liberian people that cannot afford to go to private sector or seek care abroad, we are going back to work. While we are working, people who know that we are faced with these challenges will come to call us for a dialogue. If not, we'll continue to work. But mind you, we are going to work strictly in line with the international best practice.
Yes, so my name is Rufus Levan Brooks Jr. and I report for Prime FM. I'm concerned, two questions quickly. You mentioned returning with heavy hearts and the possibility of referring patients for operations due to the Civil Servants Code of Conduct. Could you clarify your status on said issue?
Okay, so this is the issue we're talking about. We came out, and for every time we go to media at the level of the health sector, people say, or the level of the Ministry of Health, people say, oh, we are important. Nurse and anesthetists are very important. You guys are in limited number. You guys are very important to the healthcare delivery system. So we raise our issues of poor compensation, the issue of $10 pay grade for every one of us. We are not asking for us to be paid physician salary, but neither asking for extra money from government, but money that government is giving to our colleagues within the sector. And we met as a team. We are currently 76 that are working for government. The few of the numbers are working for private entities. So we said there's a need at the 760 that is the higher benchmark within the pay grade system of the Ministry of Health or the government on a CSA for everyone to be aligned to that pay grade. We started working around a writing government. In government, we're not waiting to listen. We went to go slow action since the 12. You can from the 12th up to present. We found out that almost a 1 month plus or 21 day plus. Nobody coming to us. People only coming to say, go back to the hospital, we'll do SYZ for you. Can we put it into MOU? Oh, take up our words. So what we are saying here is that government is government. The government is bigger than you and myself, and no man can fight the government. So we are going back to work. But the government should also know that we are going to work strictly in line with the best labor practice. And I'll give you the instant. For NS, the General Secretary that just took through the press conference, he works at CJ Health Center. There are 2 anesthesia providers there. Those 2 nurse anesthetists, they're going to do their schedule in line with the best labor practice, meeting the requirement of 48 hours each on a weekly basis. So the rest of the days that they will not be on call or maybe considered as their day off, the government going to answer questions to the medical director or whoever that there.
In addition to what you just said, it's actually true and frustrating that we are demotivated because, say for instance, I can show you, some of our members are only alone in some hospitals. I'll give you an example, like Grand Gide, only 1 nurse anesthetist responsible for everything in the whole hospital, in the whole country. There's no day off, there's no schedule. He's been sacrificing throughout. In the whole of Grand Cayman County, we are only 3 in the entire country. And then we are trying to seek at least some attention from the government, but the government has failed to even listen to our intentions. That's part of the struggle that we've been going through.
How do you feel about your decision to return to hospitals and work alongside doctors who you think some of their issues were attended to by the government of Liberia?
So yes,
Okay.
just as the president said, we are going back to work. It is not a matter about feeding. It is our passion. This is what we go to school for, and this is what we learn. We are going back to work, as we said earlier, not because we are happy to be looking at the impact our go-slow action have had on the majority of the citizens in Liberia. And like what they were saying, there is no government-connected hospital in Liberia that have a single doctor, that have a single surgeon. But there are counties. First I said hospital, right? Now I'm saying counties. But there are counties in Liberia that have a single anesthetist. I don't have the experience. He has no day off, as I was saying. He has no leave. He has nothing. We got members in our group whose wife had divorced them because of being alone in a rural area, and there is no time for their family. They are going through all of those sacrifices. So what we are saying is sure that we are not asking people to give us additional money. No. That government looking at our face and tell that for all anesthesia providers in Liberia, this is the set salary that we have for you guys, and bring all of us to that minimum pay grade. It is not about us, because people have been, misinterpreting what we are saying, that we are asking for our salary increment. We are not asking for salary increment. NS and I will be working at LGH in Bombing. I make 760 and then make 300, and we are doing the same work at the same time. That is very unfair. So we are saying that if the 760 or the 600 is what government intend to give to us and anesthetists, NS and I in the same hospital should receive that amount. So we are going to the hospital, we work along with the surgeon that our work, but they know, like the president said, if I work my 8 hours per day, I go home. Any other patient that come for surgery, they will have to be transferred to the nearest area. And that is where we don't want to go, because it will almost be looking at something that we are striking. So we are still calling on there that our doors are open. We can come and negotiate. We can talk.
Yes. Yeah, this is Joseph Napoli from CH1E Hospital. We ask for the reason for which we are going to work. As we read from the press conference release, the go-slow action is not actually affecting those who can afford because they go to private facility. I can give you an example. There was a patient that was referred from another hospital, Bon Mais, to send to Kakata, and when the patient team struck action, the patient was referred to Monrovia, and before reaching to Monrovia, the baby died in the woman's stomach, to say so, for your level of understanding. Now this is very painful. It is not affecting those people who can afford, but it is affecting our poor citizens who are innocent to our decision making. This is a reason, not that we are afraid, but this is one of the reasons why we intend to go back to work.
Okay, so again, my name is Augustine Tumachi, and I work for the Redemption Hospital in Nikutan, Bushwood Island. We have decided to go back to work because it's not because we are happy or because of weak-minded. We are returning to work because of we are returning to work. We are returning to work with a heavy heart. A heavy heart in the sense that we are in sympathy with those patients that are not able to afford to go to JFK, especially like what other my colleagues have said. Some of them have to come to Redemption where they may be paying $120 to do their surgery in case they can't deliver themselves. So in the process, if we are not there, they might lose their baby, or perhaps they might either be involved in losing their own life. So we are going to work with a heavy heart. We want to save people's lives, not because of what the government have done, listening to our plight. We want to return to work, but we are in sympathy with Liberian people.
All right. Yeah. So the issue of the phrase "heavy heart," guys, is just clear. The fact here is that you had two children, and they were put out of school for tuition, and you intend looking after the bigger one or the older child, and maybe just buying a slipper or a PE sneaker or a PE shirt for the smaller one. The both of them return to work. Do you think the one that you paid the school fee for and bought the PE sneaker, the PE shirt, the PE trouser, and other school material, you will be happy? But the one that you took only the initiative to buy PE sneaker for and not paying the school fee and buying the rest of the thing will not be happy. So that's the situation with we and the doctors. We are not against the doctors. No. Neither we don't want their salary. But the fact that we came also as a team and that issue was resolved to some extent, and they did not come up for the public to see whether they have issue with anymore. And we were the only people being looked at, and we're going back to work. We are not happy. Like I tell you, those stakeholders that we should be looking after to solve our issue, some of them going to private sector, some of them flying to Ghana. Like I gave you an instant for the president of the Republic of Liberia, President Joseph Numa Bouaka, when he's sick, he goes to EWA. He will not go to Redemption to know that there's an anesthetic on strike. I can give you an instant that there was a time that to establish an RV land, it was very difficult. It was my colleague that just spoke. Joseph Tanapoli and I went in our place to establish an RV land. We are the same people talking here today. Why he couldn't go to Redemption? If you are going Redemption, without us being there, you will know our important. But those people who supposed to change the narrative, they get the opportunity to go to private hospital or even fly abroad. So returning to hospital, it doesn't mean that we're happy, but we are only doing it for the sake of the Liberian people that cannot afford. So it doesn't mean that we are very happy from our heart. So that the phrase heavy heart has a meaning there.
Right. And because of we are majority that making us, and the love of our people that making us to go back. As our president and everybody have said, we are not happy, but we have been taught. We have been taught to be vigilant. We have been taught to be stable in the midst of hard time. So we can rest and show you that whatever that we've been practicing and whatever quality and services that we have been giving, we're going to continue to serve our people 100%. They work for us.
Okay, I want to make a clarity because recent times it was in the news that they have increased nurse and anesthetic money to 500, and I want to make this clarity. So anesthetic already making 760, some are already making 500, some making already 600, some already making 300. Now the issue of the disparity we've been talking about, If you making 300 and another person is making 500, all right, and you just add 50 across the board, have you solved the problem of disparity? No. So we want to get this clear that we are naturally happy about this. We want this issue of disparity should be worked out, and we should have a fixed salary structure. Thank you.
Alright, so that's the clarification.
You have what you can do on this, Michelle.
Thank you so much. My name is Rufus Devon Brooks Jr. Baba from our